Hello everyone, my name is Benjamin, and today I'm going to be discussing one of the questions in our homework 2 assignment. The question goes like this. It's a clinical situation. Mrs. Z, a young woman with rhesus negative blood, came to a clinic when she was 8 months pregnant with her third child. The second child died of yellow jaundice. Explain the basis of the concern of her unborn child. Be sure to discuss the following in your explanation: the concern about rhesus incompatibility and its relationship to hemolysis, the previous sensitization from 2 pregnancies, noting especially the death of the second baby, and the prophylactic use and the non-use of Rogaine. Uh, Before I start discussing uh, Mrs. Z's situation, there are a few points that are noted or rather explicitly mentioned that need attention. One of the points is rhesus incompatibility and its relationship with hemolysis. The second factor is previous sensitization from the previous 2 pregnancies. And the third factor is prophylactic use or non-use of Rogaine. And then before I start discussing that situation, there are a few terms that are important for us to note, or rather for us to explain their meaning so they can help us understand this situation uh, well. The factors are as follows. One of them is the rhesus factor, 2, isoimmunization, 3, hemolysis, 4, bilirubin, 5, yellow jaundice, and 6, Rogaine. To begin with rhesus factor, it is a blood group antigen present in the blood of some individuals. It is just merely a type of protein that is present in the blood of some people, not everyone. And according to B.J. Cohen, 85% of the United States, population of the United States, have the rhesus factor, or rather, they are rhesus positive. The rhesus positive people, the people who have the rhesus antigen are said to be rhesus positive, and those without the rhesus antigen are said to be rhesus negative. The second term is isoimmunization. Isoimmunization is the development of specific antibody directed at the red blood cells of the same individual. It usually happens in rhesus incompatibility situation. It is the antigens, or rather, okay, isoimmunization is the process, or rather the development of the antibodies which are designed to attack the red blood cells of the same individual. The third term is hemolysis, which is actually noted as one of the important points over there. So hemolysis is the third term that I'm going to be talking about is hemolysis. Hemolysis is the breaking down of red blood cells and the subsequent release of hemoglobin into the plasma. So hemolysis, it is a disorder, a disease, characterized by the breaking open of the red blood cells and the subsequent release of hemoglobin from the red blood cells into the blood plasma. Bilirubin is a bile pigment, a type of substance or rather waste product that result from the breaking down of hemoglobin, of red blood cells. Bilirubin is a bile pigment that results from the process of hemolysis. When the red blood cells are broken down, uh, bile pigments are produced as a resultant factor. So that bile pigments accumulate in the blood and if not taken away by the liver causes a problem or rather a disease that's called yellow jaundice. So yellow jaundice is the yellowing of the skin and the whitening of the eyes. It's the yellowing of the skin and the whitening of the eyes due to accumulation of bilirubin in the blood, which I have said bilirubin is a bile pigment. And the last term is ROGAM, which is a type of medicine that is used to prevent isoimmunization. It is used to prevent the development of antibodies to fight the red blood cells of the same individual. Now that we have a basic understanding of those few terms, we are now ready to discuss Mrs. Z's situation. And Mrs. Z's situation was a case where Mrs. C herself is rhesus negative, and her unborn baby is rhesus positive. In such a situation, what happens is uh, when rhesus negative blood comes into contact with rhesus positive blood, the rhesus negative blood perceives the rhesus antigens, or rather the rhesus protein, as a foreign element in its blood. So it automatically develops a type of antibodies that are designed to fight these rhesus antigens. Unfortunately, these rhesus antigens are contained in the Unfortunately, these rhesus antigens are contained. Unfortunately, these rhesus antigens are contained. Unfortunately, these rhesus antigens are contained, or rather go along with the red blood cells. So when the antibodies are developed, they fight the red blood cells of the rhesus negative blood and destroys them. And that is the situation that we discussed earlier, that we say is called isoimmunization, the development of antibodies, which are going to fight, or rather which are going to cause hemolysis, which is going to fight the red blood cells and breaks them open uh, to destroy them. So in Mrs. Z's situation, the first child was rhesus positive. Mrs. Z is rhesus negative. So Mrs. Z's blood developed antibodies which were designed to fight the rhesus antigens in the first child's blood. So when those antibodies are developed in the body, they remain in the body, they don't go away. So when Mrs. Z conceived her second child, the antigens, or I mean the antibodies, which are already in Mrs. Z's blood, started fighting the rhesus positive antigens, which are in the second child's blood. So the result was that the second child's blood was attacked, and the red blood cells of the second child's blood were broken up, and that is a disorder that's called hemolysis. So as a result of hemolysis, the second child developed a disease that's called yellow jaundice. And we note from the question that the second child died of yellow jaundice. So that is the reason why the second child died of yellow jaundice. So Mrs. Z's concern, one of Mrs. Z's concerns are the death of the second child, which was caused by the breaking down, or rather the process of hemolysis, which caused yellow jaundice. Now, Mrs. Z is pregnant with her third child. The antibodies that caused hemolysis, which developed yellow jaundice that killed the second child, are still present in Mrs. Z's blood. So, the same, given that the third child is still rhesus positive, the same antibodies are going to attack the red blood cells of the third child, which means that the situation must be taken care of. So when Mrs. Z visits a doctor, probably what is going to be done is to administer ROGAM, which is a type of medicine that is going to suppress the development of the antibodies, or rather is going to suppress, or rather prevent, the reaction between the Mrs. Z's antibodies with the child's red blood cells. So that way it prevents the breaking down, or rather prevents or stops the process of hemolysis. The use of ROGAM is to stop the production and the reaction of antigens due to the presence of rhesus factor, or rather rhesus antigens, in the blood. So to summarize, Mrs. C's situation is where the first child was rhesus positive and Mrs. Z's blood is rhesus negative. So antibodies were developed by Mrs. Z's blood to fight the rhesus antigens because the blood of Mrs. Z perceives the antigens as foreign factors. So by the time the antibodies were developed, the first child was safe. So the first child was not attacked. The second child was attacked because the antigens were already in the blood of Mrs. Z and they were not treated. So they developed the antibodies had already developed, so they started attacking the red blood cells of the second child, thus causing hemolysis, which resulted in yellow jaundice that killed the second child. Now, the third child is going to undergo the same process unless ROGAM is administered to Mrs. Z's blood. So what ROGAM does is to suppress the reaction between Mrs. Z's antigens that attack the red blood cells. So in other words, it prevents the attacking of red blood cells of the third child by Mrs. Z's blood. I think that is going to be the end of our discussion, and have a nice day. Thank you.